Hey Ryan,
Yeah.
you have a 911 tower up on the old Re-Energy site.
Do we?
Do you know anything about that? I
Um,
think we could talk about it later.
think that
The service guys just happened to pull in.
I think that's the one that we rent from. I think that's an AT&T tower that we rent space on.
Oh,
But I don't remember. I don't remember.
All right, let's get started. All right, good morning, everyone. Thank you for joining us this morning for another Reboot Lewis County webinar. These webinars are co-hosted by Lewis County Economic Development and the Lewis County Chamber of Commerce. We are your two business support organizations for Lewis County. So I want us to go around and give introductions of who we are. My name is Brittany Davis. I'm the Executive Director of Lewis County Economic Development. And if Shai, you want to introduce yourself, and then Kristen. Shai might be driving, so I will introduce her. Cheyenne Stereo is our Director of Finance and Incentives for Lewis County Economic Development. And Kristen, go ahead.
I am Kristen Nocter. I am the Executive Director at the Lewis County Chamber of Commerce.
Perfect, thank you. So again, thank you all for joining us this morning. We really wanted to focus on the topic of reopening the economy. We're seeing that in the media, we're seeing that in the news, we're hearing it from Governor Cuomo. May 15th, reopen the economy. It's going to be on a regional basis. So what we really wanted to do is bring in Ryan Pichet, who is the county manager for Lewis County, and Ashley is the director of Lewis County Public Health, to really speak on that from a local level and what that reopening of the economy here in Lewis County and for the North Country region really means. So what we're going to do is we're going to keep following the same format that we normally have been, 20 to 30 minutes from hearing from Ryan and Ashley, and then we will give about 10 to 15 minutes of questions. If you do have a question that comes up during their conversation, please feel free to write it in the chat box. But if not, we can wait until the end, and if you want to ask a question in person, that's fine as well. So without further ado, I'd like to introduce Ryan Pichet and Ashley Waite. You guys can take it away.
Okay, thank you, Brittany. I'm going to run through some of my stuff. We'll keep it pretty light, pretty conversational, and then Ashley will share her screen, right? Ashley, you've got a PowerPoint as well?
I do not. Nope.
Oh, you don't? Okay. All right. Well, then we'll handle these things together. First of all, thanks for using the best picture of me of all time, Brittany. That's awesome. Okay. So I think the big picture here is that the governor, I think we're all following along with the Pause New York. We all know that order is set to expire on May 15th. And I think the assumption is that, okay, May 15th, no cases in Lewis County. We've made it through. We have beat the coronavirus. And I am certainly not here to be the bearer of bad news, but none of those things are true. Yes, the Pause New York order does expire on the 15th, but the reopening framework that the governor has put forward is regional, but it has some burdens that our region is not yet close to overcoming. So basically there's 12-step process for reopening. These are the guidelines that have been established by the governor. Each region, and our region includes 7 counties, basically from Watertown to Plattsburgh, so the whole northern rim of the state. As a region, we have to meet these 12 guidelines. So more or less, these 12 guidelines can be split into 3 categories. The first is your amount of sickness. So you have to make sure that your numbers remain low in terms of positive tests. You have to make sure that your hospitalizations remain low, and that on a rolling average, you're continuing to keep your numbers down. Now, that is not a problem in our region. Our numbers are very, very good. Lewis County is the best in the region. Frankly, we're the best in the state. We have 0, positive cases right now. So that's the first category, largely speaking, is the numbers. The second category, largely speaking, is capacity. So it's all about healthcare capacity, having excess ICU beds, having excess hospital beds, and having excess PPE, personal protective equipment. We do very well in that category as well as a region. We check every single box. We have excess capacity. We have PPE. We've done very well. The third category is the stumbling block, and that is testing and tracing. And I'll let Ashley explain the importance of testing and tracing, but basically the governor has set a standard of 30 tests per every 1,000 citizens. And we have to reach that threshold of testing capacity in order to reopen the region. So in Lewis County, if you have 27,000 people roughly, and you have to have 30 tests per 1,000, then we have to have 810 tests per month. As a region, we have about 420,000 people, 30 tests per 1,000. We have to do about 13,000 tests per month. Okay, so far total in all of Lewis County, we've done how many tests, Ashley? What are we up to today?
378.
378. So since the beginning of this virus, we've done 378 tests. And the governor says in order to reopen, we have to do 810 tests per month, which we can do. We have the staff. We have, shortly the hospital will have the testing equipment to, that we can put the swabs in, and it'll tell you, if you have the virus or not. What we do not have is this, the swabs. Very simple piece of equipment, but there's a shortage. We only have about 300 on hand. St. Lawrence County, Jefferson County have, 500, 600, 700 on hand, which is great, but you're not going to get to 13,000 per month in our region without a massive scaling up effort of these test swabs. And so to me, that is going to be what's going to hold back our region from starting to reopen. There's no way by May 15th, I mean, at least not in my mind, there's no way we're going to have 810 test swabs here and 13,000 for the region by May 15th. There's just no way. So that is a big problem. It's a federal government problem because we just don't have these tests, and it's a state problem because when they have received tests, they've sent them downstate and not upstate, which makes sense. They have more of a problem. So with that, Ashley, can you talk a little bit more about the importance of testing and tracing and what the future, might hold in that category?
Yep. So we've been fortunate here in Lewis County to only have the 11 cases, but that certainly doesn't mean we've only had 11 cases. Testing is important to find those cases and properly isolate them, do the contact tracing, which is what the governor has referred to a lot, army of tracers. So for every positive case, we need to find out who that person has had contact with and also quarantine them to try and contain the virus where it is. Now we know that there's asymptomatic transmission, so people don't necessarily need to be showing signs and symptoms of the illness to transmit to others. So this is another important reason why testing is necessary to find those individuals. So to date, we have kept up with symptomatic testing. The state has expanded now to other categories, essential workers being one of them. However, like Ryan said, the swabbing material has been our barrier. We are bringing another form of testing, antibody testing, to Lewis County. And I'm currently working with the state to try and hopefully have that count as some of our testing, because it is a good screening to say who actually needs the PCR test, which is the diagnostic swab up the nose test. So, and I'm not the only county who's pushing for that, because that capacity is there. Supplies are not an issue. So we're hoping to have more clear answers from the state, you know, as this week progresses. We certainly know this pandemic has taken a huge economic impact, and we are working hard to reopen safely as soon as possible. So Ryan, did you want to go on with other stuff, or do you want me to talk more specifics?
No, we'll keep moving through, Brittany, the material here. So as we mentioned, here's the basic categories. This is right from the governor's PowerPoint, and you can see the North Country, we have checked 5 of the 7 boxes. So this is what reopening looks like. You have to be green in every category in order to reopen. To me, the testing is going to be the biggest hurdle, which I think we've discussed. But the North Country does well. You know, we have, you know, our less dense population, I think, has protected us from the brunt of this. So we could be one of the first regions to open, but we're still not quite there yet. When we do open, here's what the governor has outlined as the structure. So phase 1 is construction, manufacturing, wholesale supply chain, select retail using curbside pickup only. So to me, that's what you know, we're looking forward to the most, is trying to get to that phase 1. But I think there's a lot of businesses on here that are searching for, uh-oh, where am I? I'm a restaurant, phase 3. Yeah, that is, you know, that's a concern that, you know, we can't even get to phase 1 until we have that testing material. And then from there, how do you get to phase 2? We don't know. The governor hasn't set those standards yet. My guess is this could be something that takes us the majority of the summer to move through. But we don't know. I think we all watch the governor every day and learn more information. I don't think anyone in our region, honestly, has more or better information than anyone else. I think we're all watching, learning, and trying to figure things out at the same time. So, Ashley, anything to add on this?
Just, you know, a piece of past information which the governor has not mentioned in recent press conferences, but logically, there should be about 2 weeks in between phases to monitor the infection rate, because as you know, the incubation period is 14 days. So by the end of those 2 weeks, we should know if we are going to see an uptick in cases because of the certain phase that reopened. But he hasn't made mention of that in any of his recent press releases. So that's what I have on that. In regard to specific guidance, we've also been told that we would receive specific guidance for certain types of businesses, summer camps, campgrounds, that type of thing. We have not seen that guidance from the state yet. The 7 public health directors of the 7 counties in the North Country region are meeting weekly and also exchanging many emails to make sure that we're all on the same page in regard to what our guidance should be, making sure that we're taking a consistent approach, talking through the questions that we're getting from businesses. And also we will try to collaborate if there's a business that has a best practice. They've got a very innovative idea on how to safely reopen, then that's certainly something we want to share amongst the region so that everybody remains safe as we reopen.
So I think this is where the Chamber of Commerce and the IDA can help because we are going to need to put out very specific guidance for each type of business. You know, what does a fitness center look like when it reopens? What does a hair salon look like when it reopens? And we'll probably get some basic guidance from the state, but I think locally we're going to want to work together to put out more detailed and easy to follow information for our businesses. You know, you guys shouldn't have to hunt through this, you know, the governor's PowerPoint deck and press releases to find the information that's relevant to your business. That's where, you know, the county and the chamber and the IDA can help. And that's what we plan to do, is we plan to be the ones following it closely so that when it's time to rock and roll, trust me, we are going to be, Lewis County will be the first to get things moving. We're not going to wait a moment. And I think we're all on the same page with that. So.
Yeah, and Ryan, if I can add to that, between my office and the Chamber of Commerce, you know, we're already, you know, researching those types of standardized policies and procedures. And, you know, like you just said, we really don't want the businesses to have to research this themselves. So we want to make this as seamless and easy as possible. So that's what we will be working on now and into the future, is to just make this an easy process for everyone.
Perfect. So obviously this is your, you know, your resources here, what you guys already know about. Ashley, I know you had some other bullet points to hit. What else was on your list?
So I just want, in general, businesses to start to think about innovative ways in which they can achieve social distancing or providing personal protective equipment at their place of business to their customers and their employees to make sure everybody is safe as we reopen. So there has been clear cleaning and disinfection guidance that's come from the state, and also CDC has a specific cleaning and disinfection during reopening. So that guidance is clear and it's out there. Some other things to think about is screening employees as they present for work to make sure that they're not sick, and if they're sick, sending them home. Wearing masks and having masks available, rearranging workspaces to promote social distancing. So what could that look like at your place of business? Working in teams, so splitting schedules, staggering breaks, any kind of curbside pickup, appointment only services, and making sure individuals wait until their appointment time is it's ready for them before they actually come into your facility, and staggering appointments. So I want to tell you the whole goal of this is to try to reduce the density of people and to contain the droplets that spread the virus. Those are our two main goals. So like I said earlier, just because we've found 11 cases doesn't mean that the virus is not here and the virus is not spreading. So as we test more individuals, we'll have a better understanding of exactly what that looks like here in Lewis County. But until then, we should assume that it's here and that it's spreading and take the proper precautions while we reopen safely.
So just a note on what the future might look like, broadly speaking. I think we're talking about a slow ramp up, just like we saw with the phases, phase 1, 2, 3, 4. I don't think it's going to be over 6 or 8 weeks. I think it's going to be over several months. And I think the future for the next 18 months to 2 years is very much about testing. It's about tracing. It's about identifying the virus in our community and isolating those instances as quickly as possible, isolating the people who have had contact with those positive cases. This is not something that's going to go away. It's something that we have to manage. And so having the buy-in and support from our business community is going to be extremely important, because what I think the reason people are being so cautious, and it's annoying, trust me, I'm annoyed with it too, but the worst case scenario is that we fall back into a situation that we were in mid-March and have to do this all over again. And being in a state with New York City, one of the most densely populated regions in the world, means that our area is susceptible to more flare-ups of this virus in the future. And so the way we approach it and manage this smartly is going to determine whether we have to go back and do another round of pause. So it doesn't feel like it's up here, and it doesn't feel, like Lewis County needs to, do anything. We're so much different from New York State, and that's from New York City, and that's true. But we could just as easily have a second round of outbreaks as any place. And like it or not, we're in New York State. And so, we're going to have to play by the rules that everybody else has to play by. So that's my personal opinion on what the next year or two looks like. So Ashley, anything else to add, or can we do questions?
We can do questions.
Yeah, we have a number of questions that have popped up in the chat, so we will address those. First question, is there lab capacity for the tests?
Ashley, go ahead.
The lab capacity is there. The staff is not the issue. The testing material itself is not the issue. It is the actual swab that is the issue. The swab that's put up the nose to collect the sample. Those are what we are having issues getting. Thank you, Ryan, for the visual.
All right, next question. Let's see. Who is selecting those to be tested? Is there a person mandated to be tested, and are there New York State ramifications if they refuse tests?
There's not people mandated to be tested. I have a list of individuals who qualify for testing and who I need to prioritize based on testing materials available. The number one is symptomatic. Those are individuals that we have been testing all along, and we have been meeting that need as people present for testing with symptoms. The next category is contacts of positive cases. We are testing those individuals. We're testing them 11 days out from their contact with the positive case, because just if we tested them immediately after, just because they tested negative then doesn't mean that they're not going to test positive, within that 14-day period. And the 14 days really is a cushion. So we're testing on day 11 so that they can be released from their quarantine on day 14. And like I said, there's really nobody that's mandated to be tested. We are requiring the contacts to be tested at this point under their quarantine orders.
Thank you. Next question. Any idea which phase religious gatherings would fall into? I think like Ryan said, you know, it's a very general list at this time. There's a lot of businesses that and organizations that aren't specifically listed. And I'm sure this will become more comprehensive as time goes on. I don't know if Ryan, if you agree with that.
Yeah, I do. Religious services are something that are pretty fundamental to our lives. So I think they, you know, as soon as they're able to be done safely, we want to get those up and running. But it is a large gathering, so that's a very tricky question.
Mm-hmm. And this brings us to our next question about large gatherings in general. So obviously, the Lewis County Fair, Food Truck Fridays, Cream Cheese Festival, you know, these are all events at risk of being canceled, if not already canceled. So what do you feel is the future of those large gatherings, even into the fall?
Ashley, why don't you give the public health answer and then I'll give the bad news answer.
So it's hard to predict what the virus is going to do. This is a new virus, so we're learning more about it every day. So to say, you know, into the fall, what it's going to look like, nobody has a clear answer to that. There's lots of predictions in regard to that, a second wave, and things like that. However, right now, it's important that we reduce that density, and large gatherings are only increasing that density and giving the virus a vector in which to spread rapidly. And that is exactly what we do not want. The more contacts a positive case has, the more difficult public health responses, and the more difficult it is to contain the virus. So that's why we try to reduce the density. I know that the state is looking at if there's innovative ways like drive-in kind of events where before everybody would be together kind of on foot or seated, more of a drive-in where everybody's in their car. They're looking at, you know, innovative ways to do those kinds of events, and it's not possible with a lot of events, but they're looking at those and reviewing plans that are submitted. I do know that.
That pretty much covers it. I guess a little more bluntly, I don't think we're going to be having large gatherings in Lewis County this summer, my opinion.
Yeah, I think we can all agree it's going to be a very different summer, and we're actually going to have time. We always say we never have time in the summer to do anything because it's so busy, right? I think we'll actually have time to just hang out in our backyards and just chill all summer long. So we have Beaver Camp and Oswegatchie Educational Center on currently. So you know, they're obviously looking for guidance. They have families calling. So we will make sure as soon as that guidance comes out, we will get that to you guys.
That is one guidance document that we've been promised now. They've said, the state has said the guidance is written and it's just in the hopper waiting for approval. So until it's approved, we don't receive it, but it is something that they're working on.
I mean, I think Ashley and I have talked about this a couple times, so we'll peel back the curtain and let you know what our conversation has been. The thought of bringing students from all across the region in and out of a confined environment with cabins and bunk beds 5 or 6 times a summer is very likely not going to happen. So I unfortunately we should wait. We should, you know, hear where the state's going to come down on that. But I think in terms of, just being straightforward with you guys that are waiting for answers, I think it's highly unlikely.
And in our region, obviously they're a big economic driver for a lot of our region. And there is staff that comes from all over the world to staff these summer camps. So that's another thing that we need to think about. That's not appropriate for, staff to come from everywhere to one confined area. So those are all things that need to be taken into consideration.
Perfect. All right, next question. If the virus was spreading, wouldn't you see the rise in hospitalizations and the need to be more precautious?
So the virus affects everybody differently. We've seen this here even in Lewis County with our 11 cases. Some individuals are very sick and some are hardly sick at all. Maybe they feel like they have a little cold. So if it's not reaching those individuals that are going to be the ones that get really sick, then we wouldn't know about those. And that's a really good thing. So just because our hospitalization rate isn't high, again, doesn't mean that it's not here. One thing that will tell us more is if we test more. So that's why it's so important that we get those swabs to know exactly, get a true rate of what our infection is here.
Yeah, it's frustrating. I mean, it's frustrating because we don't feel like we have a major problem in Lewis County or the North Country. And, we really don't have a major problem, but this is a major issue in New York City. It is. And, the state's economy is 95% New York City and 5% upstate. And of that 5%, probably 0.05% is the North Country. So when you look at the state's decision-making metric and how they're going to, go forward in a way that is best for the state, it's going to be about those 12 million people and not about our 400,000 people, and certainly not about our 27,000 people in Lewis County. So not that we have some autonomy to be smart and do things, for our community that makes sense. But in terms of, the big picture and where things are headed, we've got to remember that it's not going to be about us. And that's just the nature of New York State. It's not going to be about us. It's going to be about New York City and those 12 million people that live on Long Island and Westchester. So.
Mm-hmm. Yep. All right, next question. Will the tracer job title employee work for Lewis County Public Health? So are you going to be hiring people to do this or use county?
So this has been something that the governor has made seem to be a new concept, a new job title. This is something that we've been doing from day one. And Lewis County specifically has enough contact tracers between our current staff, and we have trained some other county staff to assist us when the caseload is high. So we have enough for what we need, and we will not be utilizing that army of tracers that the governor is speaking of here in Lewis County. We will be utilizing our own staff.
I will say our public health department has done an incredible job at the contact tracing. And I do agree when that came out, when the governor started talking about that a week or two ago, my thought was, we're already doing that here in Lewis County. So awesome job to you all. Next
and really,
question.
The majority of the state is doing that. It's really just the downstate regions that couldn't keep up with the thousands and thousands of new cases they were getting every day.
Question from a participant of the Lewis County Leadership Academy. They were trying to make plans for their community day of caring project. Should they focus on a virtual based project? Or what do you recommend as something that would be helpful during this time? And that might be a discussion you guys can have after the fact as well.
Yeah, I think there's definitely innovative ways to get that kind of a project done where you're not having a large group of people together. I don't know specifically what the project is. I know I was part of last year's class and we did community cleanup or different projects. And it was just a couple of people on each project site. So, you know, those are things that I feel are important to our community, and we need to find innovative ways to get those done.
Adding on to that, I know we have a lot of community members who are sitting at home right now that are used to volunteering and going out and helping the community. Besides not going out and stopping the spread, how can everybody else help? Is there a way for everybody else to help?
Not at this time. Ryan, do you have any ideas?
No. Can you make these?
Right. Make some swabs.
You know, our community has been phenomenal. The mask sewing has just blown me away. We will have provided masks to 10% of the population in Lewis County in the first 6 weeks of this. Now we have a manufacturer that is committing to making masks for every single person. We have masks set aside already for when the schools reopen. I mean, all we had to do was send out the bat signal, and Lewis County just, you know, send us an avalanche of masks, which is unbelievable. I mean, just phenomenal effort by the community. So when we start to identify some of the other things that are going to help us move forward, I have total faith that this community will come together. There is one thing that I guess popped into my head. We are participating in the Take 5 initiative in Lewis County. So this is a little more touchy-feely and less, you know, action-oriented, but it is super important to pick up the phone and take 5 minutes and call someone who's in isolation. If it's a neighbor, a great aunt, you know, someone that's in your life, doesn't have to be someone you're super close with, but if you know there's someone that's in isolation and has been by themselves for 7-8 weeks now, take 5 minutes, pick up the phone and call them, ask them how they're doing, check in with their well-being, and share how you're doing with them. Very important that we stay connected, especially our elderly folks that are very routine oriented and have not, you know, been able to see any of their friends and family. So the Take 5 initiative is important. So if you want to help, you can do that.
Thanks, Ryan. I'm going to ask one more question just to kind of wrap up this discussion. How do businesses access these masks and other PPE equipment? We cannot use the PPP money to buy these supplies. So I know that Kristen and I did have a discussion with emergency management yesterday. For those businesses who are in need, if there is absolutely no other way that they can get masks or supplies, please contact one of us and we will try to set that up for you. But again, these are businesses and organizations who this is their last resort. They've tried every other option to get, you know, hand sanitizer and masks and gloves. Please contact us and we will try to make something happen for you. Ryan, anything to add?
100%. Work through the chamber and the IDA, get us a list of who needs equipment and how much you need. and we will do our best to fulfill those orders. It's not as simple as you think, because we can't just give a business a basket of masks, because they all have to be sealed individually. So you can't just put a basket of masks on your front counter because somebody paused through and now all those masks are compromised, or somebody sneezes near them. So it isn't quite as simple as just us dropping off a box of masks, because we want to make sure that we're training the businesses on the best way to utilize that material, and make sure that we're not actually making things worse by putting something in a public place that everybody's going to put on their face. So it's a little more complicated than you might think, but we absolutely will work with anyone, any business who needs some help.
Okay, great. Well, again, I want to thank you all for joining our webinar today. I think one conclusion that we can come, from all this is that it's all work in progress. Information changes. We don't have the specific answers to all of this, but I think the most important thing is that we're all in this together. Between the IDA and the chamber and the county and public health, we're here to support you all. So if you have any questions at all, please do not hesitate to call us. And if we don't have the answer right away, we will find that answer. So again, thank you, Ryan and Ashley, for all the work that you're doing in our communities. We really appreciate everything that you're doing. And we hope that everyone has a great day. Thanks for joining us.
Thank you.
Thank you.